We're going to return to one of our main stories this morning, a report which suggests babies born a few weeks early have a slightly higher risk of developing asthma.
Researchers looked at 14,000 children over 5 years. The study, published today by the British Medical Journal, suggests doctors may need to keep a closer eye on the health of these children.
Well, joining us in the studio, Dr. Elaine Boyle, who is the author of the report, along with our sort of semi-resident GP, Dr. Rosemary. Very good morning to you both.
Good morning.
So, babies born with asthma, you have noticed a link to when they are born. Tell us about it.
Well, as your report stated, we looked at 14,000 babies who were born about 10 years ago and who were followed through until they were 5 years of age. What we saw is that there is a gradient of risk of health problems, including asthma, but not exclusively asthma, and that this gradient of risk stretches right up across all the gestational ages at which a baby can be born, right up until the due date. And we even saw a small increased risk in babies that are born just 2 or 3 weeks early.
So how does this compare with what we thought we knew before?
Well, traditionally, health professionals have always regarded babies born at 37 weeks as the same as babies that are born at full term in terms of their outcomes. And to a certain extent, we've even extrapolated that and used 32 to 34 weeks as a time at which we would say if a baby is born, that's generally going to be safe and the outcomes are going to be very good.
So, Dr. Rosemary, does this help you as a GP? If a mum comes in concerned about potentially her child having asthma, if you know there is a slight increase in the risk if that baby was born slightly earlier, does that help you diagnose?
No. I mean, to all intents and purposes, for GPs working on the ground and for health visitors working on the ground, this actually doesn't make any difference to us at all. We have to view every case on individually. To me, one of the important things about this research is it showed there was an increased risk of babies being born a little bit earlier if the mother was of low socioeconomic status or if she smoked. So I'm wondering here about chicken and egg, and actually should we be looking very carefully at why these babies are being born a bit early, and is it the underlying factors causing the slight prematurity that is the problem? And to me, the thing that I need to be looking at is really encouraging women to stop smoking and trying to help women of lower socioeconomic status who maybe aren't so confident about what they should be doing to look after themselves in their pregnancy, and also what they should be doing to look after their babies when they're born.
Yeah, so, I mean, could you address Rosemary's point there? Does your research help us in looking at the parents as opposed to the issue of whether the child is born prematurely?
I think the importance of our study is really not at an individual level, as Rosemary says, because the risk for any individual child or family is actually very small. Where it's important is the number of these babies that are born just a few weeks before full term. And I think one of the issues certainly is looking at the mother's health during pregnancy, and as you've alluded to, maybe the mother's lifestyle, although we didn't see a very, very strong effect of that.
Dr. Rosemary, when you see children and mums are concerned about asthma, at what age are you able to diagnose that it is asthma?
It can be quite difficult diagnosing asthma, but we are certainly seeing much more asthma than we used to, and this may help us with looking at the causes of it. But we have to look at every baby on a case-by-case basis, and actually the age in which they're born in a way is irrelevant. We've got to look at their health when we're looking at that baby.
As a GP, what do you consider are the most common links with asthma when you're diagnosing?
Smoking.
In the household?
Smoking in the household is by far and away the biggest link. And then we look at genetics, and there are no doubt that there are some families who are what we call atopic, who have allergic diseases. You look and you see that one of the child or the parents got eczema, one of them has bad hay fever, and then you know that that child is more likely to have asthma.
Is there a danger that people attach more significance to your findings than they should? I mean, I think what you are suggesting, Rosemary, is there's a danger of a bit of scaremongering because people will be worried unnecessarily. Does that concern you?
Well, of course that would concern me. The last thing we want to do is to spread panic and alarm among families and among mums-to-be and mothers of very young babies. And the thing I want to stress most really is that the risk for any individual is small, but this is potentially very important on a population basis.
Yeah.
And there's a lot more work needed to get to the bottom of why these babies are born.
Well, good to talk to you this morning. Thanks
And
very much.
can I
indeed.
just stress
Yeah.
that plenty of babies who are born early, and
Absolutely.
including my 2 sons, do extremely well. So, reassurance has to be the
Yes.
message.
Yeah.
Absolutely, I would agree entirely with that.
Well, Dr. Elaine Boyle, thanks very much indeed for coming
Thank
in,
you.
and
Thank
Dr.
you.
Rosemary, thank you as well.